Here with Todd Archer at SIA's 2011 conference in Arizona. Thanks for being with us, Todd. Can you tell us a little bit about your company and your position with it?
Right. I'm the president and CEO of Mutual Insurance Administrators. We're a full-service medical and workers' comp TPA in Oklahoma City, Oklahoma. We've got 6 offices in 5 states.
Okay, and you were a speaker on the Health Reform Act implications on risk and risk expense. So can you share with us a little bit about your history in the industry, because you're not a newbie, you've been around for a while, you cover a lot of lives and clients, and then how you ended up agreeing to speak on that panel, and a little bit of topical coverage of your view on how the Reform Act's going to impact costs of doing business and the like.
Sure. I've been in the TPA business since 1990, and before that, actually, I was in the stop loss end of things on the risk side. So I've been around TPAs and have been a TPA now for almost 30 years. And in that time, obviously, you learn a little bit of the tricks of the trade and the route that needs to be taken to make yourself successful in our business. And as far as the session goes, that's how I got there. And I'm also the past president of the Healthcare Administrators Association. And during that time, we actually made an effort to try to connect with SIA for us to collaborate, particularly as we went through healthcare reform on the legislative end, on ways we could try to impact that legislation to benefit our industry as a whole. And so I think a result of that collaboration between HCAA and SIA kind of led to us kind of reciprocating in working at each other's conferences to further our industry.
Do you see that health reform legislation improving efficiencies or bringing down costs of health care in the future for employers and employees?
The healthcare aspects as they exist today, while you could argue that there certainly are some social benefits to them, cost was not something that was addressed as part of that legislation. As a matter of fact, everything they've done to this point is going to result in an increasing cost to employers in the system.
Not terribly good news.
Not terribly good news, and of course a lot of it. There's still a lot of things that still have to be resolved as it relates to that legislation, regulations that have to be passed. Some of those things could, kind of help offset some of the cost.
You see smaller TPAs falling off. Will there be a roll-up just to comply with the increased reporting requirements and everything?
I think there will continue to be a consolidation in the market. There are a lot of, particularly the first-generation TPA owners are now well into their 60s. And at some point you go, look, I'm not either willing or not able to continue to make investments in the business, and I think that will continue. There'll also be consolidations, I think, in the stop-loss arena as the smaller players. It is still very much a scope and scale play, and so everybody's trying to figure out, okay, how can I get to the size I need to be and still maintain the high level of service that our industry's known for.
Do you see more employers possibly going to self-insurance and captive routes to try and control health costs?
I certainly do. Obviously the way the legislation is written right now, there is an advantage to a self-funded employer over being fully insured because of some of the medical loss ratios, some of the community rating initiatives that are part of the legislation. Is going to create a disparity between the costs that are going to have to be incurred on the fully insured side versus some of the things that will not apply to self-funded plans. That will make self-funding more attractive to all size employers.
Okay. Are you involved with some of the captive insurance companies, or right now as a TPA?
Currently we are not, but we have in the past. We have been. We have worked with some captives. We've had some of our employer clients that have utilized captives for the risk component of what we do. Okay. And I will tell you, my sense is there is going to be, I think, a significant increase in interest in that as a way to kind of help combat some of the increased expenses that are going to be resulting from the current legislation.
Okay. I appreciate your time, Todd, and appreciate you joining us here. And if there's something else you want to add, please do. Otherwise,
thank you very much. I appreciate you.
Have a great rest of the conference.
Thank you.